Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Bhooshan Zade with us. Dr. Bhooshan Zade is the Director of Radiation Oncology and is currently practicing in Ruby Hall Clinic, Pune. For the past 13 years, he has worked as a radiation oncologist and he is a member of Medical Council of India as well. Welcome to Medicircle, Dr. Bhooshan Zade.
Thanks, Rashi. Thanks, Rashi, for having me here.
So from now, moreover, 14 million new cases of cancer are diagnosed globally each year. And it is estimated that over 8 lakh cases of cancer are detected in India. And nowadays, it is radiation oncology. This field is considered that it can treat cancer patients. So doctor, can you please tell our audience that what is radiation therapy?
So, radiation oncology or radiation therapy is not a new field. If you see the history, it's more than 100 years old technology of treating cancers. Of course, nowadays it's more and more advances, which is making it more accessible, less toxic, more acceptable to the larger population of cancer population. So that is why we are now talking about radiation oncology. But if you see the history, it's more than 100-year old branch of treating cancer. So what is radiation oncology or what is radiation therapy for cancer treatment? Very simple to understand if you say, see, therapy, radiation therapy. Therapy is a treatment and radiation is radiation. So what is radiation now? So if you see the generic meaning of radiation, any electromagnetic wave which carries energy with it, it's radiation. Now mainly radiation are of two types. High energy radiation, what we call as a ionizing radiation, and low energy radiation is we call as a non-ionizing radiation. And in radiation oncology, we deal with high energy or ionizing radiation for the patient treatment. So, how the radiation therapy actually work as a cancer treatment modality? Am I right? So, this high energy X-rays or radiation, with the help of linear accelerator machines, we direct towards the tumor cells, and the tumor cell on which the radiation falls, the DNA of the tumor cells get damaged, and the damaged DNA cannot multiply. So in the attempt of multiplication, it dies. So in our language, we call it mitotic cell death. So slowly, the tumor cells which has got radiation dies. But at the same time, normal tissues also get this some amount of radiation. But in normal tissue cells, they have a DNA repair mechanism. So they can escape from the injury of radiation with time. At the same time, cancer tumor cells, they cannot escape. So they die. So it's a selective way. Radiation differentiate between a normal cell and a cancer cell.
Okay, doctor. So can you please tell us that how do radiation oncologists work? Means how they treat the patient?
Right. So suppose we'll take a patient of head and neck cancer, which is a very common cancer in India. So if we take head and neck cancer, we divide into two categories. First is upfront operable, like CA tongue or CA buccal mucosa, in which case the patient goes for surgery first, and based on the histopathological report of surgery, we take it further in the form of adjuvant radiation therapy or adjuvant chemoradiotherapy. And the other variety is where surgery upfront is not possible because of the advanced nature of the disease or because of the location of disease, in which surgery becomes too morbid or too big, or it's just not possible. So in that case, when the surgery is not possible, we treat with direct radiation therapy along with concurrent chemotherapy. So that aspect is called definitive chemoradiation. Right. So now we have a situation or case of head and neck cancers in which radiation therapy is required. So now the intent of radiation therapy is to kill the tumor cells, to push high doses of radiation which are required for the death of the tumor cells. At the same time, we have to preserve the normal tissues which are around the tumor. Right. Suppose in head and neck, what we have normal tissues like eyes, skin, parotid glands, which are salivary glands. We have a spinal cord behind, then we have a skin, we have a larynx, which is a voice box, we have esophagus. So there are so many normal tissues in this region which we need to protect from the harmful effects of radiation. At the same time, we have to push heavy doses of radiation, high doses of radiation, kill those tumor cells. It needs planning, what we call treatment planning. conformal treatment planning, so that the radiation beam goes to the tumor conform such a way that the normal tissues around are avoided. So there are steps. The first step is immobilization. So head and neck case, so we immobilize this portion of body in a thermoplastic mold, so that when we treat the tumor, patient does not move. Right. So the planning done on the computer is perfectly executed on the patient. But if the movement is there, then the execution will not be perfect. So the first step is immobilization. Second step is CT simulation. So we take a CT data set, we acquire a CT data set of that part. So the patient is virtually inside our computer. We can see the tumor, we can see the normal structures around, we can delineate the tumor, save the normal structure, create a nice plan, evaluate a nice plan with respect to those volume histogram, and then make a final plan which is to be executed on the patient. This is called treatment planning workflow. It takes typically around 2 to 3 working days to plan this kind of a conformal planning. Now, there are different types of conformal planning. We will not go into details of the technical words and jargons, but this is how it works. So once planning is done, patient comes to radiation on a daily basis. So typically for head and neck cancer is a 5 days a week for 6 weeks. 30 to sittings of radiation spread over 6 to 7 weeks. That's how the treatment is planned. Once started, it's a daily treatment. Every treatment session would need around 5 minutes of time on machine, and it's absolutely OPD treatment. Patient walks in, takes his radiation, goes home. Generally 90-95% of times we do not need any admission, any supportive care, because we counsel patient on OPD basis what care has to be taken, skin care, nutrition, hydration, all those stuff. But sometimes because of some other issues like comorbidities, diabetes, blood pressure, yes, patient may need admission, but that is less than 5%.
So is radiation therapy similar to chemotherapy?
No, chemotherapy is these are medicines in the form of injectable, in the form of oral, that has to be administered to the patient. It goes via oral route or via intravenous route. It's a different ballgame, different specialty altogether. Radiation therapy is a local regional treatment. I just explained how it works. We use radiation, we use machines. It's a different specialty. Yes, there at times we use these two modalities together, what we call concurrent chemoradiation. So when the radiation is going on for 6 to 7 weeks, in between either 3 weekly sessions of chemotherapy or weekly 1 session of chemotherapy is administered. That is called concurrent chemoradiation.
Okay, doctor. So on which type of cancer is radiation therapy most effective?
Right. So if you take solid tumor, apart from blood cancer, almost all solid tumors, if not almost all, so at least 80 to 90% of solid tumor cases at some point of time in their cancer journey would need radiation therapy. Now, few types like head and neck cancers, breast cancers, cervical cancers, esophageal cancers, those cancer patients require radiation therapy early in their treatment. There are certain cancers which are like more of a chemotherapy first or more of a surgery first. Radiation therapy comes as a palliation, or radiation therapy comes as a adjuvant treatment. But yes, in all solid tumors, 80 to 90% times radiation therapy is required.
Okay, doctor. So can radiation therapy completely cure cancer?
Yes, it depends on stage of cancer. In an early stage cancers, in a localized cancer, radiation therapy is curative treatment. In advanced cancer, radiation therapy can be used as a palliation for symptom relief.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with more information in less time. And so we will be conducting a small question answer session today in which you can either answer in yes or no or in 1 or 2 line sentences. So my first question is that does radiation affect fertility in women?
Yeah. So fertility and radiation. If radiation is directed to the organ of fertility because of the cancer in that location, the answer is yes. But if the cancer is located in the other areas of body, like if you are treating head and neck cancer or breast cancer, then fertility is not an issue because the organs of fertility are quite away from the radiation area. So answer is no.
Okay. So does radiation therapy affect hair fall?
Okay. So if I am treating the brain tumor with radiation, brain tumor hair fall will be there because the radiation will enter through the scalp with the hairs are there. But if I'm treating the other areas of body, not the brain, then hair fall is not a problem. It won't be there with radiation.
Okay, doctor. So can you please tell our audience that is radiation therapy painful?
Radiation therapy is absolutely not painful. These are X-rays. You can compare it with a CT scan, compare it with a standard X-ray chest, which so many of you have already done because of whatever reason. So X-ray you don't feel anything while you undergo X-ray radiation treatment. But of course, radiation will have its own set of side effects, which will come in a timely manner, which we explain depending upon the disease, site, patient fitness, all those factors put together. But if you say the impact of radiation on body, it's absolutely painless. You don't feel anything while patient is undergoing radiation.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you, Rashi. All the
Thank you
best.
so much. Thank you.